Hey everyone, welcome back to another video. In today's video, I'm going to talk about 3 things that I love about emergency nursing. So let's get on with today's video. If you want to gain more information about nursing, please consider subscribing down below. I upload a video every single week and you don't want to miss it. Also, if you want to get cool shirts like this, please check out the description box down below. I do have a t-shirt store and you can go check out different designs that I have personally created. Anyways, let's talk about emergency nursing. What are some things that I love about it? Well, for me, I'm personally quite a restless person, and so the chaotic environment of the emergency nursing makes you always be running around, working on your feet, helping people. If you're not helping your patients, you're either helping other people's patients. And so you're always running around doing something, keeping you busy. And that's what I love about emergency nursing the most. But if I were to say 3 things that I really like, the first thing I would say is that you treat every age group. So when I was on the floor, I would typically see, adults. You would never get pediatric patients, and generally speaking, they would be like upwards of 40 to 90 years old. However, ever since I worked in the emergency department, I'm seeing every demographic in the hospital. I'm seeing babies from 3 months old. I'm seeing people from 95 years old. You get a wide range of age demographic that you treat, which is really interesting because then you learn all these different things about, teenagers. You learn about kids, you learn about neonates, all the different interventions that nurses can provide for these demographics. So that's something that I really, really enjoy. The amount of people that you get to treat from different age groups. The second thing that I love about emergency nursing is the fact that you do so many skills. Like I said, within your 12-hour shift, there is no downtime. You're always running around doing something. And a lot of the times it requires you to do interventions. So there are times where you put NG tubes in, you put Foleys in, you do so many different skills. A lot of the times, skills that you never even do on a floor. So for example, conscious sedation is something that I've never done on a floor, but in the emergency department for reduction and synchronized cardioversion, those types of things are quite common, and you see them quite commonly in the emergency department for a variety of different reasons. So the amount of skills you do in the emergency department is so big, and you get to see so many different people, and you have these interventions for different types of people as well. So for example, the other day I gave intranasal ketamine to I think it was an 8-year-old who had fallen off their motorbike, and the doctor needed to do a reduction. Well, I had to administer the intranasal ketamine and monitor the patient. Of course, I called respiratory therapy as well to be there, but it was quite an interesting experience having to do that. And that's something that I never would have gotten to do upstairs on the floor. The last thing that I love about emergency nursing is the fact that you work in a team. So a lot of people think, you go to the hospital, you see the doctor tells you what's wrong, and then you go home. Well, it's not like that. And I know a lot of nurses that are watching this know that's not true. But I think in the emergency department in particular, you do a lot of teamwork. There's a lot of, respiratory therapy involved. There's SLP quite often involved for acute strokes, if they're dysphagia, if they're elderly and they're losing cognition, and all of a sudden, they have an infection. We want to check their swallowing reflex, all these different types of disciplines that you come into contact with that, you definitely don't come into contact with as often on the floor. Another big one is the psychiatric nurses. When I was on the floor, I rarely saw a psychiatric nurse. However, in the emergency department, you see so many psych nurses that come in to help you assess and treat your patients with mental health problems. If they're in an acute manic stage, there's always a psych nurse that looks up the patient's chart and understands what kind of things to expect for this type of patient. And obviously, where the goal with that is to provide patient-centered care for, benefiting the care of the patient. Anyways, guys, those are a few things that I love about emergency nursing. If you found this video helpful, please consider giving it a thumbs up. I would greatly appreciate it, and we'll catch you in the next video.